New York is lifting its indoor mask mandate.
Governor Kathy Hochul announced she will not renew the rule when it expires tomorrow. The governor issued the mandate in December when Omicron surged, instructing businesses to either require masks or check people's vaccination status. COVID cases in the state are now back to what they were pre-Omicron, but mask requirements in schools will remain in place. New York follows other democratically led states like New Jersey and Connecticut in dropping its indoor masking mandate. CBS News' Bradley Blackburn has more.
New York is poised to become the latest state to end mask mandates for most indoor public places.
Fantastic idea. They need to get rid of the mask mandate as soon as possible.
Personally, I would keep my mask on, because there's all these sorts of different variants still, emerging, and, we just have to stay safe.
Governors across the country are expressing a desire for a more normal way of life. Dropping the most visible public health measure comes as average COVID case numbers are down 69% from a peak of more than 800,000 on January 15th. But the CDC says other metrics are still too high.
We still have hospitalization rates that are higher than they ever were during the peak of our Delta wave, and similarly for deaths, still at 2,300 a day.
The CDC continues to recommend universal masking in schools regardless of vaccination status.
School mask mandates will expire soon in New Jersey and Connecticut, despite the CDC guidance. In many areas of the country, it's up to local school authorities.
For Indiana, it's definitely too soon. It's great that our numbers are coming down, but we're basically looking at where we were at the beginning of December, and that's still really high.
Another reminder the pandemic's not over. The youngest Americans aren't yet eligible to be vaccinated. Bradley Blackburn, CBS News, New York.
And for more on this, Dr. Jerry Abraham joins us now. He is the director of the vaccine program at Kedren Health in Los Angeles. Dr. Abraham, thank you very much for joining us.
Good morning, Tanya.
A lot of states are dropping indoor mask requirements, as we saw in some places. It's for everyone. Where you are in California, it's only for folks who are vaccinated. What's your reaction to all of this?
No, I think it may be a little too soon. It's probably early to be moving so fast on removing masks. But I don't think that's the whole story. I think we're going to still wear masks in schools and on public transportation, in airports and airplanes. And we're really going to have to continue to follow the local jurisdictions. So here in LA, we're going to do what our Los Angeles County Health Department asks us to do. And we'll continue to follow those restrictions. It's not entirely over. That's really what I want people to know and hear, that while we have vaccine fatigue and COVID fatigue, letting our guard down just really allows cases to continue to creep up, and we really don't want to risk another variant. So it's a delicate balance between the pressure we're feeling from the public to remove masks, but I don't think it's snap our fingers and tomorrow masks go away. And I still think you need to listen and kind of follow what's happening within your own environment, community, and culture.
Well, Dr. Abraham, speaking of your own environment and community, you did mention that masks will still be required in schools, but there are several states that are eliminating that requirement for schools. We do know that vaccination rates among school-aged children are still fairly low. We also know they don't seem to be getting as sick. So tell us about the risks and the benefits of not having kids mask up in school right now.
Yeah, absolutely. And as you see right behind me, we've got tests and vaccines. They're piling up. The demand is gone for all of it. I think after Omicron, people's attitudes really have changed. What we're excited about is that 6-month to 4-year-olds will soon be eligible for vaccines. So we're going to have a whole new rollout that allows the youngest amongst us who've been ineligible this whole time to finally have access to vaccines. And that's why things like masks are so important, because there remain vulnerable people around us. Cancer patients, our aging relatives, and the youngest, who are absolutely vulnerable to respiratory illnesses. So I really do believe that if you feel that you are putting someone at risk, it's absolutely reasonable and appropriate to wear a mask. And also, I just urge the public not to demonize anyone who makes the choice to wear a mask as we move into this new normal and people start taking off their masks. But we really do think they play a very important role, especially when we talk about KN95s and N95 masks. We've seen that they really mitigate and reduce the spread of COVID. Why would we get rid of such a useful tool at this time?
And on that note, the CDC, of course, still telling people to wear masks inside. At what point do you think the CDC will align with these states and saying it's not necessary? Are we at all close to that point right now?
Yeah, it's really tough. I think a one-size-fits-all policy for the nation is challenging. I do think that states by states, based on the number of cases, I think as we look to the Super Bowl, for example, this weekend here in LA, we're going to want to be very careful. We've got people traveling from all over the country with different vaccination rates, different approaches to mask wearing. So we won't be surprised if we see an increase in cases here in LA, for example, and then we need to make decisions based off of that. So it's really hard to say we can set one policy from the CDC in Atlanta and expect that to resonate or make sense for all of us across the country. And I think that's really going to be the story between now and the summer. And let's just fingers crossed hope that we don't get another variant. So we kind of got to get on with our lives, the new normal, pandemic to endemic. But of course, we also want to be ready and prepared in the event we need to change our strategies and go back to strict mask mandates or really encourage vaccines, especially amongst those who aren't vaccinated. There's still a third of the country that needs vaccines. And I really want to encourage everyone to go out and get their first and second doses and to know boosters work.
Dr. Jerry Abraham, thank you so much. We always appreciate your perspective, especially all the way over in California. We appreciate it.
Thank you.